The limb embryology. In this theme, we will discuss the important genetical factors that govern the limb development, which are the homebox, the sonic hedgehog, the fibroblast growth factor, and the 1-7 genes. The limb development starts at the 4th week of development as a growth of mesoderm along the lateral body surface. And what determines the correct location of this limb bud along the cranio-caudal axis of the body is the homebox gene. So the mnemonic is that the limb homes to its correct location by the homebox gene. And as you can imagine, any mutation in this gene will result in a limb bud in the wrong location. The ectodermal surface of the limb bud thickens to form a ridge, and this is called the apical ectodermal ridge. And it's involved in the secretion of two important genetical factors, which are the fibroblast growth factor and the 1-7 genes. To understand the functions of these different genes, we should understand the orientation of the embryo. And the best way to imagine the embryo flying in the air, with the abdomen facing downwards and the back facing up, the limbs extending outward with the thumb facing anteriorly and the little finger facing posteriorly. So anything toward the thumb is anterior and towards the little finger is posterior, and this is the anterior-posterior axis. Anything facing the dorsum of the hand is dorsal and the palm is ventral, and this is the dorsal-ventral axis. Anything close to the trunk is proximal and away is distal. Two important regions will secrete the genetical factors. One we have already mentioned, which is the apical ectodermal ridge, and the second is the zone of polarizing activity. The zone of polarizing activity is located at the base of the limb posteriorly, and it secretes the sonic hedgehog gene. And as you can imagine, it will control the posterior-anterior axis of the limb since its location. And also the sonic hedgehog is involved in the central nervous system development, and any mutation in it will result in holoprosencephaly, where the midline structures will be partially or completely fused. Moving to the apical ectodermal ridge, it will secrete the fibroblast growth factor. And the way to remember the function is that you can imagine the fibroblast growth factor laying down layers of fibrous tissue, making the limb grow longer and longer. So it controls the proximal and distal axis, lengthening the limb. And the second gene is the 1-7 gene, which controls the ventral and dorsal aspect of the limb. And the way to remember this function is that you would remember if you want something, you will get it by your palm. And all of these factors control the relation of structures to each other and their proper position and organization along the limb. So in summary, the cranio-caudal position of the limb is controlled by the homebox gene. The anterior-posterior axis will be controlled by the sonic hedgehog gene. The dorsal-ventral axis is controlled by the 1-7. If you want something, you get it by your palm. And the proximal distal lengthening is controlled by the fibroblast growth factor as it lays down fibrous